or family member falls to the floor. They will not answer you. They don't seem to be breathing. Your heart drops. You don't know what to do. You feel so helpless. Has this ever happened to you? It happened to me on a highway about 20 years ago. There was a wreck and the man was laying in the road. He would not answer. He was not breathing. I was so nervous, but I knew what to do. I started CPR. I'm a nurse, but had just started my career. I had never done CPR on a real live person before. Since then, I have become a certified CPR instructor. CPR, or cardiopulmonary resuscitation, is a series of steps used when someone stops breathing, their heart stops, or they become unconscious. You use CPR as soon as these events occur. The quicker the better, and the quicker the more chance of survival. Time wasted is heart and brain wasted. Since my first experience, it has become easier, but there's still nervousness. After all, there is a life at stake. That is the importance of CPR, the human life. It's something simple, like these following steps could help save someone you love or somebody someone else loves, and they're important for everybody to know, not just those in the medical field. Most deaths do not occur in the hospital. They occur in the home. So CPR should begin in the home. If you wait to the hospital, it's often too late. CPR, started early, stimulates blood flow to the heart, brain, and vital organs, providing the necessary oxygen so that there is not damage to these organs. Today, I will demonstrate the 4 steps of CPR and show you just how easy it is to learn and why everybody should know. First of all, there's 3 easy steps, and the 4th step is just a continuation of all of the steps together. So, when you come upon someone who has fallen or appears to be unconscious, the first thing you do is try to see if they're responsive. You shake them, and are you okay? You shout to them. You shout loudly so that they can hear you, if they are able to hear you, because that is the last sense to leave the body. At this point, you see that they're not responding, and you call and get help. If someone is there, you have them call and get help. But either way, you want help on the way because it is important for them to get to the hospital as soon as possible. Now your part comes in. You go between the nipples on the chest and you do 30 chest compressions. You do those quickly. The beat of the human heart is 80 to 120 times a minute. You want at least to 100 a minute. You don't have to count them. Just be sure you're doing more than one every second. MSNBC has reported that a lot of nurses and physicians are using a song performed by John Travolta, Staying Alive. It's the beat of the human heart, and it works for keeping you in rhythm. So you can hum it as you do it, and you know the goal actually is staying alive. After this, you're going to get down here, you're going to look, listen, and feel for breathing. If they're not breathing, you're going to tilt the head, lift the chin, pinch the nose, and completely cover the mouth with your mouth. Give them 2 deep breaths. Be sure each one comes out before you put another one in. This is also known as mouth-to-mouth resuscitation. At this point, the 4th step comes in. And the 4th step is continue your compressions, continue your breathing. 30 compressions, 2 breaths. Child and infant CPR is much the same, except with the child or infant, you don't call first to get help. You go ahead and give them a 2 full minutes of CPR. Of course, with the infant, you're not going to push as deep into the chest. With the adult, you go 2 inches. With the infant, you only go a half an inch. But it's actually the same thing. The same ratio is 30 to 2. Okay, we've discussed the importance of CPR and just how easy it is. A mnemonic to remember is to check, call, pump, and breathe. There will still be nervousness when you do this the first time, but you have to remember that you're helping someone who cannot help themselves and may not have a chance to survive if you do not help them. I told you of my first CPR experience. I did not tell you of the result. The 23-year-old man that I stopped to help made it to the hospital alive. His injuries were too severe, however, and he did not make it. He did not survive. But his family was given the reassurance that he did have help, that someone was trying to work with him, and that he was not alone. And I have learned in doing CPR, there are successes and there are failures. But what you have to do is do your best to help until it's out of your hands, and it will be rewarding when you do have success. Is there any questions? Okay. I'm going to go over the quizzes to see what you learned from the presentation, and I have a handout to give you that's something that you can put on your mirror in your purse or whatever that kind of shows you the steps for CPR. There also is a type of CPR that is used where you don't actually give the mouth-to-mouth. A lot of people today don't want to give mouth-to-mouth because of the risk of infection and disease, and it just simply involves the 30 compressions. The compressions is what creates the blood flow that stimulates the heart beat and simulates it as well, so that the blood flow will go to the vital organs.